Dementia is a term that describes a group of symptoms affecting memory, thinking and social abilities. It can interfere with your daily life and activities, and it can affect your emotions and personality. Dementia is not a normal part of aging, and it can have different causes and types. Some of the common signs and symptoms of dementia are experiencing memory loss, poor judgment and confusion, difficulty speaking, understanding and expressing thoughts, or reading and writing, wandering and getting lost in a familiar neighborhood, trouble handling money responsibly and paying bills, repeating questions, using unusual words to refer to familiar objects, taking longer to complete normal daily tasks, losing interest in normal daily activities or events, hallucinating, or experiencing delusions or paranoia, acting impulsively, not caring about other people's feelings, losing balance and problems with movement. These signs and symptoms can vary depending on the type and stage of dementia, and they may not always be obvious or consistent. Sometimes, they may be caused by other factors, such as infections, metabolic problems, nutritional deficiencies, or side effects of medications. That's why it's important to recognize the signs and symptoms of dementia and seek professional help when you notice them. A doctor can help you diagnose the cause and type of dementia, rule out other possible conditions, and provide appropriate treatment and care options. Early diagnosis can also help you plan for the future, access support services, and participate in clinical trials. If you or someone you love is experiencing any of the signs and symptoms of dementia, don't hesitate to talk to your doctor. The sooner you get help, the better you can manage your condition and improve your quality of life. Communication is one of the most important aspects of caring for someone who has dementia. It can also be one of the most challenging. Dementia affects a person's ability to understand and be understood, which can lead to frustration, confusion, and isolation. However, there are some strategies that can help you communicate more effectively and compassionately with your loved one who has dementia. First, you need to be aware of how dementia affects communication. Depending on the type and stage of dementia, your loved one may experience some or all of these difficulties: finding the right words or using the wrong words, repeating words or phrases, losing the train of thought or getting stuck on a topic, having trouble following conversations or instructions, misunderstanding what is said or meant, forgetting names, places or events, having difficulty reading, writing or doing math, having trouble expressing emotions or feelings. These challenges can make communication frustrating for both you and your loved one. However, you can try to overcome them by using some of these tips. Use a calm, friendly, and respectful tone of voice. Don't talk down to the person or use baby talk. Don't yell or argue with the person. Don't criticize or correct the person unnecessarily. Use simple and clear language. Avoid slang, jargon, or figures of speech that may confuse the person. Use short and direct sentences. Break down complex tasks into simple steps. Repeat or rephrase information if needed. Use nonverbal cues to support your verbal communication. Make eye contact and smile. Use gestures and facial expressions to convey your message. Use gentle touch to show affection and reassurance. Pay attention to the person's body language and respond accordingly. Give the person your full attention. Eliminate distractions such as TV, radio, or other noises. Face the person and position yourself at their level. Speak directly to the person rather than to their caregiver or companion. Don't interrupt or rush the person. Give them time to respond and listen patiently. Engage the person in meaningful conversations. Ask open-ended questions that encourage them to share their thoughts, feelings, and memories. Avoid questions that test their memory or knowledge. Validate their emotions and opinions. Show interest and empathy in what they say. Be flexible and creative in your communication. If the person is having trouble finding a word, offer a gentle cue or suggest a word. If the person is repeating themselves, don't show annoyance or boredom. Try to redirect the conversation to a different topic or activity. If the person is having trouble understanding you, try using a different word or example. Respect the person's dignity and identity. Use their preferred name and title. Don't talk about them as if they weren't there. Don't assume they can't understand or participate in a conversation. Include them in decisions that affect them as much as possible. By following these tips, you can communicate with empathy and respect with someone who has dementia and avoid common pitfalls that can cause misunderstanding, frustration, and conflict. Remember that communication is not only about words, but also about feelings, emotions, and relationships. By communicating effectively, you can strengthen your bond with your loved one and improve their quality of life.